share some great news about the future of neuroscience and how we can work together to help accelerate it. You know, as far as I can tell, based on the lovely conversations I've had, everyone here has one of these. And for good reason, we're interested in protecting our brains. This is the source of all human ingenuity, creativity, invention, innovation, and inspiration in all of human civilization. And so this is a very important organ for all of us. And it actually leads to a question of, what are the problems facing the brain? It turns out that over 2 billion people on the planet today suffer from some form of neurological or psychiatric illness. Over 2/3 of us in our lifetimes will suffer from a brain-related disorder. Let that sink in. These numbers are staggering. This is a major problem. And I dare say that to solve a problem of this magnitude, we need to employ some exponential thinking. And if you're like me, you'll agree that neuroscience is a field of very high complexity, but at the same time represents an extraordinary set of opportunities. Turns out humans have been trying to fix the brain for a really long time. 5.5 millennia ago, Neolithic people were doing brain surgery. This is a craniotomy where the patient survived, we know from the healing around the edges of the bone window. This is in the Natural History Museum in Lausanne. And something like this always gives me a bit of a sobering pause, because 5.5 millennia later, we're still at it. My colleagues and I are the modern day equivalents of those Neolithic cavemen with stones and chisels. I've been training for the past 6 years as a neurosurgery resident at Emory University, and we take care of a broad variety of patients with brain and spinal disorders there. It's extremely gratifying work. I'm very proud of the work we do, and at the same time, it allows me to have some insights into the major problems in the field that need solutions, and the really cool technologies that are on the horizon, as well as those that are now merely dreams in the minds of innovators. And so, luckily, we're living in an age where we're on the cusp of a golden era in neuroscience. This is the golden age that we're living in right now. There's been an outpouring of support and funding from both public and private sources for neuroscience in the past few years. These are some of the institutions. Any veterans in the room? Happy Veterans Day. DARPA is a major, major contributor to neuroscience. We have the traditional agencies like the NIH, public initiatives like the White House Brain Initiative, but also private companies, like the tech companies, are getting involved in funding neuroscience work. Groups like the Allen Institute providing the basic tools that neuroscientists need. This is the best time to be alive if you love the brain. I'm very excited about that. Just take a look at this. This is the number of scientific publications on PubMed related to neuroscience. I just pulled this off the other day. This is the past 3 decades. Take a look at those numbers. It's extraordinary. I don't need to tell anyone in this crowd what the shape of that curve is, right? This is unbelievable. And the same thing is true for patents. Novel brain-related patents around the world, this is not just US, follow the same distribution. This is an accelerating exponential increase in the amount of commercialization activity related to the brain. And so, I think we're really in an era now where even beyond the medical sphere, we're seeing an explosion of interest in conversions between neuroscience and tech. I'm very excited about this in particular. All of a sudden, all the technologies that we have, computers, smartphones, wireless communications, miniaturization, all these things that are coming out of the Silicon Valley world are now tools for neuroscientists, and many of them are reaching the consumer space earlier than the medical space. We've heard today and last night about a number of initiatives on non-invasive and invasive brain-machine interfaces. We have groups that are using EEG to help you control your mood, whether it's focus or calm, even stimulating the brain to bring about changes that you'd like to see. We're in the infancy of this field. I'm very excited about it. I think we're heading toward a brain-based future where every single one of us, and not just the early adopters in this room, but average citizens, are going to be using technology to influence their own brains and be acutely aware of their own brain's physiologic and chemical states at all times. On the medical side, this is also true. This is a patient undergoing deep brain stimulation at UCLA. He's awake during the surgery, playing his favorite musical instrument as the air is hitting his cerebral cortex, demonstrating that his tremor is now gone. Incredible, incredible stuff. Tools are now available that weren't accessible to the greatest scientists a few years ago. Now to the average person can download the Allen Brain Atlas on their laptop and access all of humankind's knowledge about neuroanatomy, gene expression, connectivity in the brain. This is an unbelievable tool that's free for everybody. This is the kind of thing that we have available to us today. And makers and hackers are getting involved in this movement, which I think is extraordinary. This is from OpenBCI project in New York, funded on Kickstarter, 3D printed brain-machine interface. It's open source. This is unbelievable because this is a parallel to what was going on in the 1970s with the advent of the personal computer, the homebrew computer activists. People are now doing neuroscience innovation in their own homes. And I'm very, very excited about the possibilities that are going to emerge from that. And yet, despite all this extraordinary innovation and excitement, we have to take a step back and look at things objectively. And when I'm at work, I often think about Dr. Harvey Cushing, who's the father of modern neurosurgery, a great inspiration for all of us. This is a photo from the 1920s with one of his post-operative patients, a pediatric patient. And in many ways, we're still doing the same work and dealing with the same kinds of problems that Dr. Cushing faced. And for some things, we haven't made a whole lot of progress, at least as much as I would like to see. For instance, once the brain is damaged, we have almost no ability to reliably heal it. For neurodegenerative diseases, like Alzheimer's, Parkinson's, or ALS, we have no ability to cure. And brain tumors, something that neurosurgeons work on all the time, and Harvey Cushing worked on. Well, the most common intracranial primary neoplasm is glioblastoma. It's also the deadliest. And if you have glioblastoma, your life expectancy is measured in months. It's uniformly fatal. We have a long way to go in treating neurological disorders, to say nothing of mental illness, which is a huge burden on global society. And so, to find out why, we decided to survey neuroscience entrepreneurs to find out what challenges were they facing, what are the obstacles. So my colleagues and I got together, we realized that it takes over 10 years to get anything from the laboratory, whether it's a drug, device, or other innovation, to the marketplace where we can help patients. Over 95% of patents, even things that are patented, do not get successfully commercialized by some estimates. And so we wondered why this was the case. And to our surprise, the entrepreneurs we surveyed said that capital was less than half the problem. It wasn't all about funding. That was less than half of the burden. The real burden, more than half, were things like sector experience from mentors who could provide close advising and mentorship. Access to partners, access to prototyping, access to data, access to markets, access to a peer community of other neuroscience innovators. These are the problems that we identified. And so we said, you know, the tech world that we've seen has exploded. There's been a Cambrian explosion of innovation over the past 20 years in tech. And so we looked at that and said, wow, with all of these amazing innovations that have changed transportation, communication, banking, social media, all of that, how can we apply some of those lessons to neuroscience? And maybe it's not just the tools that we need to employ, but maybe it's the methods that the tech world is using. And so on my nights off from the hospital, the occasional night off, I began hanging out with tech entrepreneurs and startup guys. And I actually learned a lot from them. And one of the things I learned was about something called a startup accelerator. And this is a model that emerged about 10 years ago out of Silicon Valley for accelerating tech startups, mostly software tech startups. This is an early photo of Y Combinator, which is now the most prominent startup accelerator in the world. It's produced companies like Airbnb and Dropbox. There's now over 230 of these programs around the world. Billions of dollars are being invested in accelerators. These are disciplined boot camps for startup companies, and they provide embryonic entrepreneurs with all the resources they need to succeed. Here's some of the things that they provide: mentors, partners, a curriculum for founders, funding, a workspace to work in, and a demo day, which is a showcase for entrepreneurs to present their wares to investors and get to the next level. So, you know, these are disciplined boot camps for entrepreneurs, startups, and it's a proven track record that has emerged out of the tech software world over the past decade and has gained traction around the globe. So we got to thinking, I got to noodling on this, and we figured, hey, you know, this work has worked so well for the tech startup world. Could we not employ those same methods in neuroscience and bring the startup culture that we see coming out of these Silicon Valley-style tech accelerators to neuroscience and bring about those neuroinnovations faster and in a more efficient way? And so I'm happy to announce here on the XMED stage that we have now completed 1 year of the world's first neuroscience startup accelerator program. And it's called NeuroLaunch. And I've been extraordinarily enthusiastic about the results of this program and the people I've had the opportunity to work with. We provide for neuroscience entrepreneurs what the tech world has been doing for software entrepreneurs, and providing some of the same things: mentors, partners, curriculum funding, demo day, etc. And the reasons to be part of a program like this: you want to be part of a program with a vertical focus, mentorship, rapid validation of your concept, business model, de-risking, and most of all, I think, a robust community of innovators, investors, and other people who want to support bringing startup culture into neuroscience to change the world. These are the 4 areas that are the highest growth areas that we're focusing on: neuromodulation, interfaces, neurotherapeutics, mental health and wellness, and neurodigital. These are the 11 companies that have gone through the program. We're very proud of what they've accomplished in these 4 areas, and we're continuing to grow. Over 120 mentors who are world-class thought leaders at the interface of neuro and startups have devoted their time to this initiative. This has been a global movement. Back one slide, please. Sorry, having some issues. Haven't solved this problem. These are clinicians. These are entrepreneurs. These are investors, people who've exited companies for several $100 million. These are neurosurgeons, neurologists, a whole cauldron of activity around neuroscience innovation. This is a global phenomenon. As I said, this is something that is catching on around the world, and it's so exciting to see this happen in the community. We're based in 3 innovation hubs: Atlanta, Boston, San Francisco, but it is a global network. And this photo from our demo day, our most recent demo day. It's so gratifying to see entrepreneurs in this space talking to one another, having interdisciplinary conversations. You have a PhD neuroscientist talking to a software coder. You have an investor who usually looks at tech companies talking to an investor who usually looks at life science companies. You have neurosurgeons talking to psychiatrists. All this is going on within the context of a community, and the objective is to accelerate neuroscience innovations. 100% hit rate so far on satisfaction. These are some of the words used to describe the value of an accelerator for neuroscience entrepreneurs. These are actual quotes: mentors, clinical connections, networking, data-driven funding, mission. This is all incredibly gratifying to see that this program is fulfilling a need for neuroscience innovators. And take one moment with me, please, and imagine a world where some of these early-stage innovations come to fruition and help society. Imagine a world where your doctor can use neuroimaging as a service. Pull up your MRI scan, 3 dimensions, on any laptop, workstation, smartphone, manipulate it in 3 dimensions, send it to a colleague, use it to do surgical planning. That's the power of data in neuroimaging. That's one of our companies. Imagine a world where concussion recovery is data-driven, and it's based on your mobile phone. Imagine a world where old drugs are being repurposed for new problems like epilepsy and other neurological disorders using sophisticated machine learning algorithms. Imagine a world where smart vital signs monitors are used to gamify compliance with all your vital signs monitoring so you can prevent stroke and heart disease if you're at risk. Imagine a world where acute strokes are treated by thrombectomy, which is removing the clot inside a large blood vessel and preventing secondary injury using a novel approach. How about a world where young children with cerebral palsy or other neurological disabilities can use neuroscience techniques and gamification and robotics to do rehabilitation and improve their function? Or lastly, perhaps most exciting, a world where we can use devices to inject viral vectors or stem cells into the brain to treat conditions like Alzheimer's or stroke in a neurorestoration fashion without causing damage to surrounding brain tissue. This is the kind of world I want to be part of. And I'm here today to ask you to share the vision of future neurotechnologies with myself and the other neuro innovators on this stage. Please join our movement. Help us to accelerate the future. And if we can do so together, we can think about understanding how the brain works, healing the brain disease, and optimizing the brain's normal function. And I think that all of our future brains will be very grateful. Thank you.
Thank you, Jordan.